The type of transfer I'd like to show you next is called a sliding board transfer. This transfer is used when the patient is unable to bear weight or when they are physically unable to get up on their feet for some reason. They do need to have good upper body control and fairly good upper arm strength. A sliding board is simply just a piece of wood or plastic sometimes that's used to bridge the gap between two surfaces that you're transferring between. This sliding board is tapered on the ends to make the transfer a little bit easier. When you use a sliding board, you need to make sure that you have a wheelchair that has removable armrests. And you want to make sure that you get that armrest closest to the patient removed prior to the transfer. Now I've already got the patient in a sitting position. I have a safety belt on her. And I'd like to ask my patient to just adjust herself a little bit so that she's scooted almost in a quarter of a turn. So I'll get her in that position just to make the slide a little bit easier. With the sliding board, all I'm doing is asking her to shift her weight to the opposite side, and I place the sliding board underneath one side of her hip. Now you can see that it's spanning that gap. I make sure that the chair is in a good position and that the chair is locked so that it won't scoot away from us. And then I'll just explain to the patient that I'm going to help her with the safety belt, and she needs to place a hand on the sliding board so that she can help to push and scoot herself across. Also, to explain while you're doing this, that she'll need to, as she slides into the chair, she'll need to reach for the opposite armrest to help pull herself into position. Okay, on the count of 3, I'd like to help you move into the chair. I'll help with the safety belt, and we're just going to slide into the chair, and you'll reach for the opposite arm as you get into the chair. 1, 2, 3. It's usually a very smooth transfer. Get the surfaces as level as you can to make it easier. Once they're safely and comfortably in the chair, she can shift her weight again for me to the side, and this can be just wiggled and pulled out. The final type of transfer that we will be partially demonstrating for you is the transfer that you would use moving a patient from a hospital bed onto either a cart or a stretcher. Now this type of transfer would mainly be done in a hospital setting, and this would be done for a patient who may need to go for a test or go for surgery, and you're not getting them up into a sitting or weight-bearing position. So you're transferring them from a lying down position to a lying down position. With this type of transfer, you need to have the hospital bed, or the cart or the stretcher flush up against the hospital bed. You need to make sure that you've got the heights fairly even so that you don't have a difficult time moving that patient from one surface to the other. The other thing I want you to be aware of is that these stretchers do have brakes on them. You'll need to make sure that you put the brakes on before attempting to transfer the patient. Make sure that you've got the side rails down before the transfer. You want to just make observation if this patient has got IV tubings or oxygen or a catheter tubing. You need to be aware of where that tubing is so you're not tugging on it or pulling it during the transfer. And when they go for a test, usually all of that equipment goes with them. So you need to make sure you've got it well prepared and you know what you're taking with you. Now with this type of a transfer, you generally will need at least 4 to 6 caregivers to do the transfer depending on the size of the patient. With this transfer, the 3 of the caregivers would stand on the side of the hospital bed or the stretcher. The 4th caregiver would be on the other side of the hospital bed. 3 of the caregivers will need to position themselves so that they are supporting the patient's body completely. The first caregiver would stand at the head, where they would be holding near the neck and the shoulders of the patient, and their other hand would be holding down near close to the trunk of the patient. The second caregiver would be standing from the trunk to the knees, and the third caregiver would be from the knees to the feet. What we would be doing is using what we call a lifter sheet or a draw sheet to help transfer this patient from the hospital bed to the stretcher. And the fourth caregiver will stand in the middle of that draw sheet. Many times what that caregiver will need to do is to get either one knee up on the bed or even completely crawl up onto the bed so that she's not straining her back or making the transfer harder than it needs to be, because she'll actually need to be going, leaning over and doing the slide this entire distance. What helps is to get the patient as close to the edge of the bed as possible. Remove the pillows so that they don't interfere with your transfer. I'll play the position of the middle caregiver on this side. We would take the draw sheet and make sure we have a good overhand hold on it. Now, if you're short like I am, you probably will need to get one knee up on the bed as well so that you're not straining your back. Make sure that you explain to the patient what you're doing and reassure them as you're transferring them. And you would have one caregiver giving the count of 3. And on the count of 3, we would move the patient in one smooth, coordinated movement. 1, 2, 3. Okay, when the patient is safely and securely on the stretcher, leave the draw sheet under them so that you can do the same transfer when you take them back to their hospital bed. But at this point, you would replace the pillow so that the patient is comfortable. And also remember, you're going to be transferring them, so you want the side rails up on both sides and securely locked. When the patient would come back from their test or their surgery, the transfer would be the same back to the hospital bed, just in the opposite fashion, with 3 caregivers on the side that will be doing the pulling and 1 caregiver on the side of the stretcher that would help with sliding across.